understand you've been experiencing a severe headache and some disorientation. Well, I will be carrying out some checks just to see what's going on, okay, and how I can help you. Before I do get into some checks, I would like you to just tell me in your own words what's been happening. All right. Okay, so you've been experiencing some dizziness, some lightheadedness, bit of fatigue, severe, obviously, pain in your head, and a bit of nausea. Okay, so when did this start? Okay, and did it come on suddenly or was it gradually? Okay, and it's just been getting worse, okay. Now, where is the pain located? Right, so it's kind of all over, but mostly just there and in your eye. Alright, and a bit of neck pain as well. Okay. So it's kind of all over, but mostly on your right. Okay. Now tell me the pain. Does it feel like it's throbbing, stabbing, pressure, mix of both, or something else? Yeah. Yeah. Okay. Now, does the pain spread anywhere else? Okay, so maybe in your neck. Alright. So, have you been getting any blurred vision? Okay. So, any flashing lights or crawling up the wall or anything weird like that? Okay. Are you sensitive to the light? Okay. So, how does it make you feel? Yeah. Okay. I can't turn the lights off, unfortunately. Obviously, I do need to keep them on, and I do apologise. There is a bulb here if you do need it for any particular reason. Okay, my lovely, just give me a shout. Okay. So what about sound? Are you sensitive to that? Okay, not particularly. Okay, but you like it quite quiet. Okay. Now, do you have any numbness or weakness anywhere in your arms, legs, face? Okay. And any kind of crawling or weird sensations in your head? Okay. Have you had anything like this before? Okay, so nothing like this. Okay. Now, how often do you normally get headaches? Okay, and what are they like? Okay, so kind of classic kind of tension headaches, eye strain headaches. Alright. When did you last go to the optician? And how was everything? Wonderful. Good. Right, so I'm going to start by asking you some specific questions just to see how you are. Alright, my lovely. So, what's your full name? And what is your current location? And what day of the week is it? And what month and year is it? Thank you. And why are you here? Okay. Okay, so on a scale of 1 to 10, where would you put your pain levels? Okay, and with the disorientation, have you felt like you're not too sure where you are or what's been happening around you? Okay, and has that made sort of your vision a little bit strange? Okay. You know, this is very concerning, my lovely, but you are in perfectly safe hands here. Okay, it does sound like maybe you're experiencing a migraine or cluster migraine or something like that, but I do need to carry out some other checks just to be sure on that. Okay. Yeah, I mean, I know the nurse saw you beforehand and she assured me that you had no symptoms of a stroke, which is good, but sometimes we can have a small stroke and it doesn't necessarily show to us, but hopefully not. Okay, now have you had any bleeding anywhere? Ears, nose, eyes? Okay, that's fine. So no signs of any hemorrhaging at the moment. Okay, obviously I do need to check your eyes and just be sure on that. And I was also told that you haven't had a seizure or anything like that. Good, that's fine. Right, I want you to remember these 3 words that I'm going to give you now. Okay, so apple, apple, chair, chair, river, river. What were the 3 words? Good. Right. I'm now going to just observe your eyes, okay, my lovely? So if you could just look straight at me. I'm just looking for any drooping, okay, or any uneven features and things like that, okay. Okay, so overall, I mean, I'm looking at your face and it's very symmetrical and I can't see any drooping, which is a really good sign, okay. Your eyelids seem to be in the right position. I've got no concerns with that, and your brows are very even, so there isn't really a concern there, okay. And your mouth is nice and even, so I can't see anything indicating that you did have a stroke, which is great. Now your eyes, they are a little bit squinty, but if you are sensitive to the light, that could explain that, okay. Your pupils are a little bit dilated. All right, my lovely. Just to check, have you had any substances today that you shouldn't have had? Okay. Okay, so you've had no alcohol, drugs. Okay. Do you smoke, my lovely? Okay. So looking at your eyes as well, the alignment seems nice and symmetrical. Okay, so that's really good signs. Okay, I'm just going to quietly observe just for a moment. I want you to just blink normally and just sit there, okay? Now, can you just try not to blink for me? Okay. Now, can you just blink really fast for me? Okay, stop. Right, did that make you feel dizzy? Okay. And a bit funny in the head? Okay, alright. Now, can you just blink slowly for me? Okay, did that make you feel anything strange? Okay, so it's just when you were blinking excessively fast. Alright. And what about when I told you not to blink? Was that okay? It was just hurting your head. Okay, that's fine. Okay. Alright, I'm going to get you to do a couple of things for me, okay? Now, when you do these, if you can tell me if you feel any pain, discomfort, any weird sensation, okay? Now, could you just smile for me? Now, smile big so I can see your teeth. Okay, relax. Can you frown? Okay, and whereabouts? Alright. Okay, now can you raise your brows? Uncomfortable? Whereabouts? Okay, relax. Now can you scrunch all of your face? Okay, stop. So that made you feel dizzy and in pain. And where was the pain? Okay. Alright. Now, could you open your eyes really wide for me? Okay, you're struggling there. Alright, okay, relax. Okay, was it the light and yeah, okay. You feel a bit dizzy, my love? Yeah. Alright. Have you had a lot of fluids today or? Okay, so you haven't drank a lot. Alright. Can I get you to just pop out your tongue? Your tongue does look quite dry, my love. Okay, relax. Just look at your lips. They are looking a little bit on the dry side. I wonder if you feel a little bit dehydrated, okay? But that could be because you haven't been feeling well and, you know, maybe you've been a bit nauseous, you've not been drinking a lot because of your head and things like that, okay? It's, you know, sometimes you don't want to be, you know, drinking when you're in pain. Okay, can I just have a look at your fingernails? Okay, relax. Right, okay. I'm going to bring my light in, okay, and it will be bright, so please be warned. But just take some nice steady breaths, alright, and if you do start to feel really uncomfortable, please let me know. But I really do need to check your pupils, alright. Okay. As you can see, it's quite bright. Yeah, okay. Just focus straight ahead for me, okay, as best as you can. Alright. Good job. Okay. Yeah. Other side. pupils are a little bit on the slow side, and they're pretty dilated anyway. Okay, I just need you to look straight ahead for me, okay? Don't look at the light, just look straight at my nose. Don't look at the light, just look at my nose. Yeah. Okay. Alright, now I need you to follow my light. Okay, so with your eyes only, if you could look here. Okay, now do the best as you can. Good job. Okay, all right. We'll stop there. You banged your head at all, my lovely? Okay, you don't recall doing that. Okay. Have you lost consciousness at all? Have you fainted or anything? Okay. Okay. Right, if you could look at my finger. Now I want you to do the same as you did with the light, so follow it just with your eyes, okay? Okay. So you are moving your eyes, which is good. This side is a little bit off. More so with the light. Okay. I'm going to put something on my fingers, okay? Okay. Can you see these? Alright, what colour's that? And that. Good. I want you to focus on my nose, okay? Keep looking at my nose, not at my finger. Keep looking at my nose, not the finger. Keep looking at my nose. Keep looking at my nose. Okay. So at the same time, it's a little bit of a struggle for you to focus. Okay. Right, if you could just look straight at me, okay? Don't look at my finger. Did that make you feel a bit strange, my love? Okay. Okay. Okay, my love. Now, if I could get you to just look at my nose, okay? Keep looking at my nose. Okay. Now, tell me when you can see my fingers, okay? Okay, now tell me when you can't see them anymore. Okay, good job. Right, so I know you said you got a little bit of sensitivity to the light, so I'm just going to get a couple of lights here, okay? So, okay, look at the light, okay? Look at the light. Look at the light. Okay. Now, was it harder the brighter it got? Okay. Definitely a light sensitivity there. Okay. Now I'm going to do the same but with coloured lights, okay? I want to know if it's just like white and warm lights that are the problem, or is it colours as well? I've got 3 coloured lights here. Okay. Look at the light. Look at the light. Look at the light. Okay, now was any colour better than the other? Okay, and which one was the worst? Now those compared to the other lights, are these better or worse? Okay. Right, if you could close your eyes for me. Okay, I want you to tell me if you can feel that. Okay, now tell me when it touches you. Okay, keep your eyes closed. Can you feel that? Okay, now tell me when it touches you. Good job. Could you tell the difference between the two objects? Okay, so I want you to tell me if it's A or B. Okay, keep your eyes closed. Good job. Keep your eyes closed. Can you feel that? And that. Now tell me when I touch your face. Okay, now did they feel the same on both sides of the face? Okay, good. Okay, can you feel that? tell me when I touch, but close your eyes. Okay. Wonderful job. Okay. Right. Can you just pop your tongue out again for me, please? Okay, can you move it around? Wiggle it. Okay, and go up and down with it. Okay, relax. Can you repeat this sentence? Today is a sunny day. Good job. Okay. What colour's that? That. Good. Close your eyes. Can you hear that? What does it sound like? Can you hear that? What's it sound like? Can you hear that? And what's it sound like? Does it sound the same both sides? Can you hear that? That. Does it sound the same both sides? Okay. Can you hear that? Does it sound the same both sides? Can you hear that? Does it sound the same? Good. Can you hear that? That. Does it sound the same? Good job. Right. Am I okay if I touch your face, my love? Okay. You do feel quite clammy. Okay, I'm just going to press. Any pain? tell me if there's anywhere that hurts the most when I'm touching. Okay, I feel your scalp. Any pain anywhere? Okay, it feels fine. Your sinuses don't feel blocked, which is good. Open your mouth for me. Close it. Open, close, open, close, open, close. Okay, now make a chewing action. Okay, relax. You do definitely have some swelling here, my lovely. Do you grind your teeth or clench or anything like that? Okay. I mean, that can cause headaches in itself. Okay. Okay. I might put my gloves on in a minute, actually. A few other things I want to check. Okay. Can I get you to just open your mouth? I'm going to have a look. Say, oh, put your tongue out a bit. Okay, look inside your cheeks. Yeah, you definitely do appear to grind or clench, my lovely. I mean, I'm not a dentist, but I can see the scarring on the inside of your mouth. Okay. When's the last time you went to the dentist? Okay, we'll go and check yourself into one, my lovely, okay. Okay. Right. Can you look at my finger? Good job. Now, can you do that for me in front of you? Okay, stop. Okay, now both hands out in front of you. This one, I want you to go like that. Okay, and swap it to that one. Okay, swap to the other. And the other. And back to the other. And back to the other. Okay, relax. Bit wobbly there, my love. Okay, now would you mind just popping your arms right out in front of you? Hold them straight out. I'm just going to observe them. Feeling heavy, weak. Okay, relax. going to have a look at your posture. This is how you would tend to sit day to day. Okay. Okay, would you hold my hands? Okay, squeeze. Can you do tighter? Can I release? Squeeze. Release. Squeeze. Release. Good. Now can you squeeze on your left? Release. Again. Release. Now your right. Release. Squeeze. Release. Squeeze. Release. Okay, both at the same time. Release. Okay, put your hands against mine. Can you push me? I'm going to push you back. Try to stop. Okay, you're quite weak, aren't you? Tired, lethargic, and you just don't want to kind of, yeah, okay. Okay. You feel quite drained after this, yeah. Okay, just going to check your reflexes. You can just relax your arm for me. Okay, drop your leg. Okay, other side, arm. Lovely, and your knee. Excellent. Reflexes are good. Quite quick. Your posture is okay, my lovely. It's probably a little bit arched at the top. Now, I'm not going to get you to get out of the bed and walk around or anything like that. I feel like you are too weak to do that. Okay, my lovely. Okay, now would you mind just popping your neck to your chest? Slowly back up, and can you go back with your head as far as you can? Okay, and back. Perfect. Now can you go that way slowly? And back. And that way slowly. And back. Any pain or discomfort? Okay, whereabouts? Okay. Is that new for you, or is that kind of a normal thing? Okay. Feel your neck. Okay. Any pain when I press? There. Okay. There. You've definitely got some tension in your neck and shoulders, my lovely. You could probably benefit from a good sports massage or something. Yeah, there's definitely some tension or something going on in that area. Could be contributing towards the headache, same with your jaw, but I'm not sure if that is the causing of this particular episode. Do you remember those words I said to you earlier, the 3 words? What were they? Do you remember? Okay, good try. Right. Good news, neurologically you are doing well. However, with your symptoms and some of my findings, I would say you're experiencing a severe migraine or a cluster migraine. Alright. Now, some of the findings were a little bit concerning, but I don't think there's anything serious going on. You definitely haven't had a stroke or a seizure, which is good. Okay. But I am inclined to get you to have an MRI scan on your brain and your cervical spine. Okay, because I want to double check and make sure that everything is fine. I think it's a must to just be safe. Okay, and I can have a look at your cervical spine, and then if there's something there that could be contributing to your regular headaches, we can get on top of it. All right. Yeah, so I think it's really good to get those checked out. Obviously, you need to go to the dentist and see what they suggest about your jaw. See if there's anything they can recommend, because that again could be causing your frequent headaches. However, I don't think that is causing your migraine today. All right. Migraines can just come on suddenly. All right, and they're not going to be all necessarily the same. Alright, so I do think you're experiencing some dehydration as well, especially that you haven't been drinking a lot and you're being quite unwell. Yeah, so you will have to have some migraine relief as well, and some medication. Because of the severity of it though, my lovely, I think I'm going to keep you in an observation. Alright, yeah, so I'd like you to be admitted to one of our neurological wards. Alright, yep, okay, and we can get you on an IV drip, okay, to get you some hydration back into you, and then we can also give you some pain relief and some migraine treatment, and we can monitor and see how you improve, and then we can get you in for an MRI scan whilst you're here, so we can check all the results over before you go. Alright, if you had maybe a silent mini stroke, that will show up. You know, obviously it won't show any like seizures. It can show up any damage and different things like that. Or, you know, it can show up certain things like MS, etc. Alright, my lovely, but I'm not saying you've got anything like that, but I'm just saying what kind of things it can show up. And then obviously we're checking your cervical spine, you know, to see if you've got slip disc, arthritis, degenerative disc disease or anything like that, and then we can get that treated. Alright, then we do need to think about long-term treatment for migraines. Okay, you may never get any more, you may start to get them. Alright, but I think it's best to keep you in, you know, monitor your heart rate, your pulse, your oxygen levels, you know, your blood pressure, and keep an eye on your pupils, etc. Yeah, because of your pupils, the way they were responding, and that it's a little bit more than if you were just having a migraine. So that's why I was concerned about your pupil reaction, the dilation, and just a few other things. So I think it's safe if I keep you in just to monitor you. Okay. Yes, some of the things that you could see if you had concussion, you see, that's why I would like you to stay in. I know you said you haven't banged your head, but that's some of the things are quite similar. All right. But I don't think there's anything serious going on, my lovely. Okay, you're going to be well looked after tonight with the nurses on the ward. All right. We'll get you down that to have this scan ASAP. Then I can review that, have a chat with you and put you on some treatment. And we can admit you to the ward and start you with the IV, give you some, maybe some cocodamol, but that could, you know, make it worse, so we'll have to see about that. And we could put you on something like Cimetropam or something a little bit stronger here. I think that's best. And then we know if there's something, you know, on the scan, maybe if there was some swelling or something like that, putting pressure on this side, at least we'll see, and then we can treat that accordingly. But I do just think it is a cluster migraine or a severe migraine, but I would like to do these extra checks just to be double sure. All right, sound okay? All right, now I'm going to leave you here to just relax, okay? I'm going to go and get a nurse and get all the ward prepped for you, okay? And then we can get you resting up in your bed, get your first lot of obs done, and then you can have your scan. All right, and I will be around to tell you what's what. All right, but I assure you that, you know, we'll get this sorted. Obviously I am a neurologist, so I'm a specialist in the brain, so, you know, I will be round to see you tomorrow as well and tell you about the results and what I think we should do next. All right. I mean, I could give you one of those, my lovely, if you really wanted to be sure. Maybe if you were getting some flutters in your eyes or a bit staring and because you were feeling a bit dissociated, I think it might be worth having one. Yeah, I'll get you in for an EEG as well. So that's going to monitor your brain waves just to see if there's any kind of signs of epilepsy. There are so many different types of seizures. Sometimes they're very minimal that you're not even aware that that was a seizure. All right, so we'll get that done as well tomorrow or later today. Yes, okay, so I'm happy with all that. Now, I know we've done lots of checks, given you lots of information, and I know you're not feeling very well at all, but is there any questions you would like me to answer? Okay. Now, well, you did the right thing coming in. All right, my lovely. Okay, we're here to help you, and you definitely need some kind of treatment, so, you know, you're better off being here where we can monitor you, give you the right treatment, carry out some tests, and, you know, go from there. Okay, but like I said, if everything comes back perfectly normal on the scan, then it's definitely migraines. All right. Lovely. So, just take your time now. All right, my lovely. Have some water, and you do have a bowl if you do need it, and I'll get the lights dimmed for you so you can get some rest. All right, my lovely. I will be back in a little while. I'll see you on the ward, and the nurses will be there to look after you over the night as well. All right. You take care now. Bye-bye.